Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. Dear colleagues in PGs, we are discussing chronic hepatitis C. In the first video, we discussed the structure of hepatitis C virus. Then in the second video, we discussed the life cycle of hepatitis C virus and knew what are the sites where the antiviral drugs they interfere and they inhibits the proliferation of hepatitis C virus. In today's video, we shall discuss the natural history of hepatitis C virus, that why it is important to treat hepatitis C virus. If we don't treat it, what are the consequences, what is the natural course, and how it proceeds. So as I said that today we are discussing the natural history of the hepatitis C virus. When a patient presents with acute hepatitis C, and in clinically, we rarely see patient presenting with acute hepatitis C. This stage of acute hepatitis C, it passes unnoticed, and what we see in most of the cases, patient with having chronic hepatitis C. And the acute hepatitis C, by definition, after 6 months, will be called chronic hepatitis C, and if we don't treat chronic hepatitis C, there's a risk that the patients will develop liver cirrhosis and its sequelae. So what are the percentages, what number of patients they proceed from acute hepatitis C to chronic, and what number of patients they progress from chronic hepatitis C to liver cirrhosis, and what are the factors. We shall discuss this in this video. When a patient, this is a normal liver, this is the chronic hepatitis liver, this is the cirrhotic liver, and this is the end stage liver with HCC. When a patient develops acute hepatitis C, as I said, in most of the cases, the patient doesn't notice that the patient has developed acute hepatitis C, because it rarely presents as acute hepatitis with jaundice or with raised ALT, raised bilirubin. It's very rare to see acute hepatitis C patients. In my whole career, I can enumerate the number of patients presenting with acute hepatitis C. So it's really very, very rare to see acute hepatitis C patients. And even the diagnosing of being acute hepatitis C is very difficult. The source of the infection must be present. We must be knowing that the patient was HCV negative, and then the patient contracted the infection from either by the surgery or by the accidental prick, or the blood transfusion, whatever it may be. And then the patient develops acute hepatitis like pictures, and the patient comes to us and then say, okay, yes, this is the acute hepatitis C, and no other cause if not found. Well, when a patient develops acute hepatitis C, then 15 to 45% of these patients, they may recover spontaneously, depending upon the different factors. They can recover, but chronicity is the hallmark of hepatitis C virus infection. Most of these patients, they do develop a chronic hepatitis C. They progress into chronic hepatitis C. So 55 to 85% of the patients, they develop chronic hepatitis C. Then out of those who develop chronic hepatitis C, 20 to 30% of them, they will develop cirrhosis. And it's not that they will develop cirrhosis within months or years. By and large, 8, 9, 10 years are required, but we know there are factors which can accelerate the rate of deposition of fibrosis, and they can develop cirrhosis earlier on. But it's 20 to 30% of the chronic hepatitis C patients, they develop liver cirrhosis. And once they develop liver cirrhosis, then the 2 to 5% of these patients, they develop decompensated liver cirrhosis or end-stage liver cirrhosis at the rate of 2 to 5% per year, and at the rate of 1 to 4%, they develop HCC. This is by and large a concept that the patient will develop cirrhosis and then they will develop hepatocellular carcinoma. But we have seen patients developing hepatocellular carcinoma in the absence of clinical cirrhosis. Yes, their fibrosis is high, but it's not required probably that they will develop all the features of the cirrhosis, clinical features, and then they will develop hepatoma. So we've seen a couple of patients where the hepatoma appears on the fibrotic liver rather than cirrhotic liver. Factors associated with spontaneous clearance, who are those 15 to 45% of the lucky people who when develop acute hepatitis C or who when become infected with acute hepatitis C, they will recover. They are young people when the infection is acquired at the younger age. Female, they do clear the spontaneous recovery is in those patients. Those who are having IL-28BC, this was the IL-28B, the CC, the TC, and the TT. These are the three genotypes. And the IL-28BCC, these genotypes, this is the genotype of the host, of the patient, not of the hepatitis C virus. So if a patient has IL-28CC, it's a chance that probably the patient will recover. And of course, if the patient has developed symptomatic acute infection, when there was jaundice, there was raised bilirubin, raised ALT, probably this group of patients, they are going to recover spontaneously from the hepatitis C. So the factors associated with spontaneous clearance of HCV, they include younger age at infection, the female sex, the IL-28BCC genotype, and symptomatic acute infection. Now, what are the factors which are associated with increased rate of fibrosis, where it was considered that 10 to 20 years are required from the fibrosis, chronic hepatitis to develop cirrhosis. Now, there are patients, we have seen patients who are rapid fibrosis, in whom they develop cirrhosis a bit earlier in years rather than in decades. And what are those? What are the factors associated? It's the acquisition of HCV at an older age. If one patient has acquired infection at the age of 10 years, 15 years, or 20 years, and the one who has acquired this infection at the age of 40 years, 45, 50 years, the elderly people, they will develop cirrhosis earlier on. And then the increased age independent of the duration of the infection. This is again a very important thing. And then the male sex, then the heavy alcohol users, and if the patient has got co-infection with HIV or HBV, or if the patient has got hepatic steatosis, or if the patient has got insulin resistance. So what we see, if the patient is diabetic, type 2 diabetes, or if the patient has got the fatty liver, whether this is the alcoholic fatty liver or non-alcoholic fatty liver, and the patient become infected with acute hepatitis C and then becomes chronic hepatitis C, then this subset of people, they develop cirrhosis earlier than those who are not using alcohol, who are only mono infection with HCV. There is no HIV or HBV, or where the hepatic fibrosis, the steatosis or fatty liver is not there, are those who are non-diabetic. So this is important. We've seen that the chronicity is the hallmark, and 20 to 30% of the chronic hepatitis C patients develop cirrhosis and then the sequelae of the cirrhosis. And because the obesity is a pandemic, the fatty liver is a pandemic, because of the huge pool of the HCV, no age is immune for getting these infections. This is the reason then when we diagnose a patient with chronic hepatitis C, so we treat each and every patient. Only treatment is deferred when there is absolute contraindication. And now when we are talking about the HCV elimination from the Pakistan and the global HCV elimination, it is important that each and every patient of chronic hepatitis C must be treated properly until unless the treatment is really contraindicated. So by this I finish my stop, and we meet in the next video. Till then, Khuda Hafiz.